All right, and we are recording, and I'm lucky enough to be joined by Dr. Poonam Malik, who's a University MedTech academic advisor, life sciences and health sector expertise consultant, economic development business mentor, and social entrepreneur based in Scotland. For her contributions to the field of biology, she was awarded a fellowship of the Royal Society of Biology UK in 2017, and has published widely on infectious diseases, research on viruses, and impact on health. So perfect person to talk about the current worrying situation on coronavirus. So thanks very much for joining me today.
It's a pleasure here. Pleasure. Thank you for the invite, and I'm looking forward to our discussion and contributing.
So can you talk us through your understanding and thoughts on coronavirus since the first time you heard about it in China until now?
Okay, thank you, Ali. So coming from my point of view, basically my academic background is as a virologist, working over sort of 25 years in the field of infectious diseases. I work both on the DNA viruses and RNA viruses and how viruses impact host cell biology, and also in terms of longer term impact on how various strategies have been appointed. So coming to your question, how the coronaviruses, so we all first started hearing about its origin in China, which is the Wuhan province and district, where we sort of initially it was information coming out because the China cases started emerging. The good doctor who originally noted it, that because this is the time when lots of flu-like symptoms and influenza-like illnesses anyway, which all affect respiratory symptoms and respiratory tract, leading to fever or discomfort, were already existing. But he noted that this virus was behaving differently in hosts, and is leading to symptoms like, which now have become worldwide very well known, that fever leading to dry cough, and respiratory distress, and in extreme cases leading to breathlessness, and hence the need for the ventilator, which is what we are hearing now. And not all patients behave like that, but he noted it, and there was also a demographic and age related response to that. In some cases, like children tend to do better, healthy population do better, but people have underlying health conditions, which here in UK you would say, in age wise, anybody over 65 who was on a flu vaccine would be the candidate that would be vulnerable to it, or anybody who is what we call it in body's natural defense system, the immune system, which will protect the human body against any foreign body invading. If their immunity or defense system of bodies was down for any reason, whether you've been through a recent operation or in your immunosuppressant drug or taking other underlying conditions like diabetes, blood pressure, hypertension, then they tend to behave very differently and respond to the virus, and they were in the high risk group and suffering. Initially, his notifications and advice was on third very promptly, and as a result, I think it spread much further than it could have been if the initial responses were taken that seriously. Unfortunately, this I'm very able doctor who identified these things and made the case for us had succumbed to coronavirus himself, and as we know, it died. And I'm not sure if we will come into the conversation about how it spread, but as now we know that it's somehow the virus has origin possibly in the bats. That's where it's found. The carrier route is still not very much known, and there are recent publications which have identified that fungal, they are the natural reservoir of it, which may have come in contact with humans because there is an illicit trade of those animals involved worldwide. So possible route that from bat they went to fungal, and then they came into humans. How? And that poses another question, and from a policy point of view, in terms of how we get, and even from business economic terms, what should we consider the policy implications of wet markets where the live animals are sent, and how much exposure people should have to unusual, because these are anteater-like animals which are normally not there, but because of the illicit trade in some cases and black market, how humans might have come in contact. And now two recent papers have appeared which have based the genomic sequence identification. So I think once that is there from China, then it has, because the world has become so small now as a result of business dealings, supply chain transactions, human movement, flights, it is becoming day by day a smaller world. And before we knew it, it was spreading from Asia to other parts, then it's Europe, and we now know of multiple our own neighboring countries which have become epicenter, and then USA and UK came into it, and now before we know it, 212 countries worldwide have succumbed to it, and we have more than 1.4 million worldwide cases positive for it, leading to over 74,304 deaths as of today, I think. So yeah.
Yeah, it's obviously a very serious situation. I mean, from a virology point of view, what are the initial steps of the infection, together with how the virus delays the immune response? So, in other words, what makes this different to previous SARS-type illnesses?
So, in terms of, as we know, the most people have DNA, deoxyribonucleic acid, as their genetic system. The viruses are unique in them, and that is because they can utilize both the DNA, which is the deoxyribonucleic acid, and RNA as well, as which is the ribonucleic acid, as their genetic material. And the coronavirus COVID-19, which is the common name as we know it as, is actually a class of viruses which is an RNA virus, and it's in major. Till the COVID-19 was the common name for it because it appeared coronavirus-like virus in 2019. But in March 10, International Committee of Taxonomy of Viruses, which is the grouping of expert virologists worldwide over, and groups that identify and name the viruses, have now named as that SARS-CoV-2, which is severe acute respiratory virus, and this is coronavirus 2. The original corona SARS-CoV-1 was identified basically as with an outbreak in 2003 when it happened in Singapore and then spread to most in some parts of the Southern Asia, Southeast Asia. It is similar to existing severe acute respiratory virus, which is SARS virus, and but also different in terms that it is a RNA virus, so its mutation rate is faster, but it's different in that it is not normally found in humans. It is a virus that has jumped from animals to humans. It has got much more similarity to what we discussed just now with bats. The virus that is found in bat, and there have been genomic mutation, which is the changes in the nucleic acid, which is RNA in this case, happens. And how viruses are very clever structures because they are like crystals. They are dead structures in reality, and they become live only when they come in contact with a live body. So that live body could be bacteria, could be humans, could be animals. So they can live and survive and grow only when they come into a growing cell, which could be any host. So they need that. Before that, they can survive on the surfaces or in environment as part of a crystal, depending on how long is depending on each virus's capability. So in this case, it has similarity to the human origin, and this process is called zoonosis, or jumping species, because it has crossed that species barrier from a bat or a pangolin, as in this case, to humans. And what happens in these are they are not unusual. We already have influenza, flu-like illnesses in the country. And to put things in perspective, I would say we have accepted almost 17,000 deaths per year, which happens with influenza and flu every year in the UK. That's the normal death rate with that. It happens and it affects different kind of thing. In this case, it probably became a very serious threat because the various reasons. First, our bodies had never seen it. So there is this when we were talking earlier about the body's defense system, which is the immune system. Once our body see a foreign object, it recognizes and it has been exposed to it. Sees means the cells have seen it and they react to it in a way that the body produces molecules called antibodies, which give us protection in certain cases, and those against which it has been protected. Then the next time when the virus or the foreign body enters the cell or a body, they can react to it, bind it, and in some cases neutralize it, clear it, or kill it. And that is when human body recovers from that, some cases mild infection, in some cases no, they clear it even before it takes over the body. Because in case of COVID-19 or SARS-CoV-2, our bodies, human bodies had never seen this. Hence, there was a severe response and mild infection and mild symptoms in case of healthy adults and children mostly. And in immunocompromised or vulnerable high risk, those symptoms and infection characteristics become quite severe. And the virus enters through the nose because it has on its surface certain molecules that binds, which are the proteins that as the antigen, which is the creates response in the body. They are found in our nose cells and respiratory tract. So from nose, if a virus particle is found and comes in contact with the body, it enters through the body surfaces and it goes through the nose into the upper respiratory tract. And then we don't know much of its biology. So the studies that are coming out, they show that it's found in upper respiratory tract, but it can grow in the lungs, and as a result, if this is much more detail come out, because hence we are saying that it is transmitted through the air droplets when people cough or sneeze. They are bigger droplets which have sort of water droplets, and it's not an aerosol borne the infection, otherwise it would be there throughout. It's only these droplets which comes through sneezing or coughing that are produced through the body and have a certain distance that they can travel before the droplets dry out, and the virus can still stick on the surfaces for certain hours, and that's exactly not clear how many, but it's still, which is why the advice is to clean your hands as possible, to touch things capable. So in that case, the body's immune response much not that well known and are not that well prepared for it. But there is hope. There is very recent paper this week that has come out, which has shown by a group to say that then the plasma from the infected individuals, when it was used on certain infected individuals, it is working. It is providing them some limit. So there is a hope that the virus is producing antibodies which can work against the virus, which means these are the class of antibodies known as neutralizing antibodies, which have the capability to work against the virus and make it neutral.
Okay, and am I right in thinking that COVID-19 is different from the initial SARS outbreak in that you can be infectious before you have symptoms, whereas with SARS, you were only really infectious after you got quite ill with it?
So that is a question. It's a valid question and an interesting one, because even virologists or clinicians are also at the moment trying to understand its behavior and pattern. As I said, it's a new virus. Initially, the advice of was that if you come in contact with somebody who is showing signs, as we say, clinical signs of disease, which in this case is fever, dry cough, or upper respiratory breathlessness, and headache in certain cases, loss of smell. But if that happens, then you definitely have it, and you were told to stay away. But then that didn't go well with the data, wherein somebody who hadn't come in contact with some people who were showing symptoms, and they infected people, cases started appearing in those places, and it was spreading. So that's when the social distancing and stay at home advice was issued based on that data. So in this virus case, the pattern was showing that in some cases, even before you start to show symptoms of either fever, which is the first symptom, mostly high fever above 37.8, or coughing, which happens, dry cough later, or sneeze. Then even before that, if somebody had it, you wouldn't know they have it, and you were shedding it. That was based on the clinical understanding of how the case was spreading. Now, the genetic studies and the clinical load have been tested, and some studies that have come out have shown that the viral load, which means that the virus that is, once it comes in contact with body, it takes over the cell, human or host cell, it produces its multiple copies as a result of a process called replication, when the numbers grow, and then it kills the cell and moves on to infect the new cell by binding to a receptor. In this case, and that process, that amount of that infectious virus somebody can have in their body is called viral load. And what the studies are showing, that in cases of people who are showing symptoms, with clinical symptoms, and some people who actually have no symptoms yet, but if you take their upper respiratory tract load, those who are infected, they seem to be quite similar. So in that case, that proves that actually virus is present in their upper respiratory tract, even though they haven't been showing clinical signs of being symptomatic or infected. And if they cough or sneeze, they can also release these viruses. So as a result, yes, in this case, it seems to be that even when you are asymptomatic, you can cause. Hence, there is the question of distancing and staying away from the people.
And talking about social distancing, which strategy worldwide currently looks like the best to you, and when will we know which strategy was the best when we're looking back?
So this is again, this is a very interesting question, which I suppose all the governments and the health bodies worldwide over are faced with, and it is a very challenging question. The simple answer is that there is no one strategy that is good for everybody, and there is no one strategy that will work across all regions and all people. And the reason I'm saying that is because the virus that behaves or moves in different parts, we don't know fully about it, if it's all the same virus or what are the difference, because like anything else, when it jumped from animals to humans, it adapted. Similarly, when it adapts, when it reaches human body, the human body interacts with it, and it's still in response to how it is taking over that, it can mutate. RNA virus mutate very quickly. So in some cases, they can become more infectious and ferocious. In some cases, they can become a milder form. So unless there have been some earlier studies done, but we don't know which particular strains and how much variation in the viral population and strains is happening across the world. The other opposite side of that is also that human bodies also react very differently. Each one react differently. We know very bigger data points, like children react well to it, in the sense we haven't seen that many cases of death in children. We know many children are not hospitalized, and even like the best cases, that 95% people, if they get infected, recover from it. And in terms of 5% that need hospitalization, from there 1 to 2%, 2% maximum are the people who are dying from it. And that particular group tends to be mostly those people who are in the high risk group, who are over 70, who are on some kind of other medication, or what we call it multimorbidity or comorbidity as a result of either low immune system or immunosuppressant drug, or diabetes, asthma, or COPD, or cancer or other health diseases. So their body anyway is dealing with other diseases or other medicine and other. So we don't even know how they react to each other. And in those cases, why the bodies can't fight the virus as well as in normal healthy population of children, it seems to. So, and what we haven't taken into consideration response yet is how different genetic racial differences react to it. Because that would be, once we come out on the other side of the coronavirus infection, which we will hopefully come out unscathed as much, because we have seen these. First SARS coronavirus 1 infection outbreak was in 2003. Then we see the other virus, which we haven't talked much about, was MERS, which was Middle East Respiratory Syndrome, which took over Middle East and then some parts of South Korea, Taiwan. In 2013, we have seen influenza S1H1N1, and we have seen Ebola. And so there are some, like Ebola took over the African subcontinent and continent hugely, and all the forces, there were a huge number of deaths, but it remained confined. Similarly to SARS and MERS, it happened in the region. This one in 2019 and 2020 has spread much wider. There are various other reasons now, because it originated in China, and China has business dealings pretty much with more or less every part of the world. Now, as we know, we depend on the supply chain manufacturing, and the travel to the eastern region has I think, as every part of the world shows, that it probably is originating from people where the people who came from infected regions to the clear regions. Hence, some cases like New Zealand, which have closed its border very early and taken down those steps. Even the recent case in India, where it was found that a group of visitors from other parts of the country were found in big numbers, and until and unless they were there and authorities didn't know about their existence, and they were all found positive later on, and they went all across different cities and different states of India. And I think out of total 5,000 cases, almost 2,000 of them have resulted as a result of that. So it is showing that there are various regions. So in terms of strategy wise, obviously, as it looks, is the best strategy for somebody to protect is in terms of identifying, contact tracing, and then quarantining and taking care of that. In UK's case, I suppose we have already gone past that stage, and lockdown is effective in the sense that it shields the vulnerable. It stops vulnerable people coming in contact with people who might have it, and can lead to that serious cases, and in some cases, unfortunately, death, where we have no idea that whether they were infected or not infected. And that can only happen if they came in contact with somebody who was actually carrying the virus themselves. They might not have had symptoms, but they were carriers of it. So in that case, that would be the way forward, I suppose. And some countries have implemented that. Which is more effective, only time will tell, because at the moment there are various strategies. Each country is dealing with it in a different stepped phase, because in Wuhan it happened in December when the first cases started to appear. They didn't close down the country's border. They didn't close down Wuhan itself till 23rd of January. And just yesterday, when they have reported zero number of cases again, I think the Wuhan is now open for business, and they've started to have their manufacturing supply, and they are picking up. Their economy has started to pick up, and they are building and supplying. Even ventilators have been coming to other places. In other cases where we see that even though it's there is another other strategy which a lot of people are talking about is testing everybody, which Germany model is. Germany is basically excessive in the sense they have gone after this in a hard manner, and they are just testing as much as they can and ramping the production of testing kits more and more. But there are certain other factors which we need to consider in there, is that Germany is which for, if we were to come on to the business impact and model side of the things, and the related point is that Germany is the largest manufacturer of ventilators here. And even in this scenario, when most parts of the world, even including, we are talking about the shortage of ventilators, needing more and more, Germany is the only country who has ventilators in surplus, and that is able to supply ventilators to China. UK themselves, we are looking for getting the orders from there, and they also are able to supply, have their own biologics and small molecule biotech factory. So that will have certain us to think in later on whether the model of having manufacturing as elsewhere, like in China for everything with entire world depending on that, and having long supply chains, or whether we need to bring manufacturing and closer to home in certain cases, and the health implications along with, obviously that will also have implications and positive things on the climate change, but also biotech, like Germany has a very strong biotech life sciences sector. They are self-reliant on that. And for us to think how much emphasis and priority we give to the biotech pharma companies who can produce our own small molecules and antiviral drugs when a cocktail of drug is found effective for it. And so that would be on. And the other, obviously, we see Italy model. We have seen that Italy did put the lockdown, and but by the time, I think it was too late, more or less the infection had spread in the community. Initially, UK's strategy initially was that we were relying on the data to some extent. I wouldn't say that that was wrong, in the sense we, as scientists, we always have to base our assumptions on facts and data that come out. The only question, addendum to that, would be that we need to take in picture, the whole picture and all the facts to say, not simply following the model from somewhere else where our conditions might not be the same. So whether people who were coming from other places had already entered the country, which were carriers, which were not symptomatic, but they were carrying the viruses, and they were and that goes very well aligns with that the London has become the epicenter, because that is naturally the travel center from other places where people have been carrying it as well. All at the same time, also the fact of that there are other countries which we need to now wait and see. Obviously, we don't want to see the negative impact of it, but countries, other larger Asian countries which have the huge population, for example, if I would say 1.3 billion people in India, and if it was true that anybody who can come in contact with it and die if they were sort of in close confinement, and that is the bodies don't react differently to it, we would have, if we didn't know about it, we would have had seen already larger number of deaths. But fortunately, we haven't seen that, despite being densely populated in there. And there are some very good examples of how it has happened and how they have contained that infection. There is a new model which the ministry there has come up with. It's called it's a Bhilwara. It's a particular district where 27 people were found. One of the first one was doctors, and how they, from there, they identified who is likely to have come in contact with them, trace them every day with the local community health system. So that's another question of how hospitals manage, but not everybody, there is a shortage of test kits. We can ramp up and we can utilize the academic or the life sciences companies' human support to either make the kits or test it. But that's an expensive strategy, which not everybody or every country in the world might be able to do it. So everyone has to look at their resources and see what they are doing. So they are basically identifying anybody who has influenza-like symptoms, which is the symptoms we discussed roughly, that whether it's the temperature or the cough or the respiratory distress, and then quarantining them and monitoring them. And monitoring, another raises question, how we monitor. We monitor by watching them human, or we monitor them remotely with the sensors, and that another brings in the importance of technology, how we can use that, or leisure management with that, and then following them over a period when they could have been infected, and then contact tracing who came in contact with them, lockdowning that region, and then containing it and following it up for 2-week period when the virus, because their advice even in the UK is that if you have become infected and showing symptoms, 7 days later, natural cycle of the virus growth is your body clears it. But anybody who comes in contact, for them, they need to be 14 days in isolation, hence that period, because you don't know when your body will take it up and then growing inside without being detected, which is called the incubation period. And then there's the release period when the virus is made and then it starts to shed. So that's the period. But for any vulnerable period who are there, obviously for any people who are there, for them, it's the 12-week sort of 3-month isolation is being recommended, simply to not burden the system. It's not that that will protect them from being infected, but it's that they don't come in contact with many people who might have been infected. As a result, they all don't suddenly become ill at the same time and not require immediate that severe medical attention, leading to being hospitalized and admitted into ICU, as at the moment our Prime Minister sadly is. And that can take into account that him coming in, I'm sure he was following all but because he was coming and leading the charge as a sort of head of government, he might have come in contact even from a sort of reasonable distance with somebody who was asymptomatic, and as a result both him and health secretary were self-isolating. Health secretary Matt Hancock, we've seen sort of he's come back and he's doing his business, but Boris Johnson's prime minister's body unfortunately is reacting differently to Matt Hancock's reaction, and that is a classic example in how different people can react differently to that. So we have to take case by case, and strategies also we'll have to see. But if I were to summarize, then I mean, no country or no world cannot remain in lockdown forever. So coming to that point of, we'll have to have an exit strategy where how we think.
Yes, I mean, this is kind of the last major thing I wanted to talk to you about. Was, you know, it's obviously very complicated looking at strategies worldwide, and it makes complete sense what you're saying about being aggressive where you need to be and being smart where you can use what you've got, and using technology and anything that you can. And like you just said, you can't stay in lockdown forever, regardless of where you are. And even in Italy, where it looked like they jumped they sort of closed the stable door after the horse had bolted. You know, you have to make a call about when to stop lockdown. And what do you think the impact of lockdown on business is in the longer term? And even, you know, I'm not just thinking about Jeff Bezos having his, you know, 100th mansion. I'm thinking about people who have their own small businesses that you know, kind of people that you work with a lot, and thinking about that in the context of healthcare. Sometimes people don't like thinking about economic decisions when it comes to healthcare, but there is obviously a finite set of resources when treating people. And you know, is it possible we have to make a hard decision about restarting the economy at the expense of some coronavirus deaths at some point, or is that not the right way of looking at it?
So, Ali, there are some very interesting points that you make there, and some very challenging, hard questions also. And it will not make you or me any popular if we were to go down to say the one at the expense of other. And the question is, this is not about, means it's not the time for niceties, as you say, because if we need to take a hard decision to protect people's health, then that takes precedence, whether it is a popular decision or not. It needs to be done because that's the need of the hour. In this case, as we have said, you said yourself, obviously, in some cases, how horses bolted and we are trying to run and close the door. But in some cases, you think whether to make a decision of locking down or not. And as we have seen certain decisions in US for some time, some states had 2 weeks before. I know Washington state had closed their schools and offices even before UK. And whereas in New York, which is like London, epicenter of travel and business, and the message from the top down leadership initially was that, okay, we don't need to take any major steps. But then it wasn't that the inherent community of New York was impacted. It's just people who came in contact with people traveling from the places where the virus was floating in the community, and they were even before they were asymptomatic carriers. And if they landed in, or in some cases symptomatic people, if they landed on the ports, and which is why we are seeing that those are the epicenter. And to some extent, I mean, all decisions from the policy, I would say we need to base them on evidence and what the information tells us. We have enough technology and data capability on our hands that now we don't need to make decisions based on gut feeling. However, good that might be. So coming to your point of Jeff Bezos, I suppose he is still the person who has benefited most. I was reading about the Forbes 100 or billionaires list, and he's still top the number one third year in a row, because in lockdown, actually, Amazon is the only supplier for anything and everything in every part of the world. So even in the economic downturn, it has done him well because he has invented a product which is actually serving the needs of the people when they are in lockdown. His delivery model was anywhere, everywhere, from anywhere, and that seems to be working. So unfortunately, in that case, he is still gaining. And another thing which you and I are using on Zoom technology. So that has obviously in lockdown brought people together. This is one example. Eric Yuan is another person who has jumped into sort of 46nd place now in the richest people in the world, simply because he has invented a product which has less barriers to adoption, and he has different models of pre-version business. So a lot of people have come closer as a result of this technology. So while we see there are businesses that have been impacted heavily, and human beings which have had, I mean, there are obviously reports of how many million business shutting down, how many millions of people losing jobs, which is a reality, because there is the certain industries which were dependent on movement of people inside those industries, whether it's the hotel industry, whether it's the travel industry, or food and travel. They are heavily impacted by, because that has banned. First, there are various things. First, government guidelines and advice, a strategy of lockdown, but also fear. I mean, people, and the stock market in certain cases is one which perpetuates fear anyway, and people will be lead to further reactions of that. So while that has happened, all the countries' governments are coming together and providing I will use the word which we haven't used in this conversation so far, is the unprecedented measures, unprecedented time. I suppose we have reached 51 minutes of our conversation and we have not used that word, which has become the most popular currently time and today. The reason for that is that these are complex times. All governments are taking hard decisions, and everybody is trying to do good by the people. And most governments have come up with these unusual and sort of never seen before packages of helping with people, trying to keep the economy growing and recovering. But despite that, obviously, there is a downtown. That means the schools, initially UK government decided to keep the schools open for to large extent. Now that has been also implemented to close because people didn't know how else to contain it if there was an initial risk of spreading. We have seen that now to a certain extent. The data coming out even from the places where things were opening were that the children were actually least affected, except in the cases where children themselves have underlying conditions, like if they have cystic fibrosis, asthma, or other treatment which have reduced their immune system, then they need to be anyway in the isolation and period for that 12 weeks, which is recommended during the higher load period. But other LD, so that reopening school is another policy that the government will need to reassess it, because how long will that remain open? But that also led to certain schools remaining open, teachers going to it, other key workers requiring. So it, and then more and more now, other reports are coming out of domestic abuse on children, the children who are on school meals. What is the what's the implications of them having, even though the government is supplying some vouchers and providing money, but whether they are reaching the intended, and also violence inside the homes when everybody is just, there is no social measure that can reach the inside the house if you shut down the technology. So I think there are other policy implication, the other impact of the decision making, which we'll have to see, and how long can we keep the children inside and rely on homeschooling model and expect most parents who are working in the households where both parents are working, they are having to still continue the full time. So while there are furloughed measures, and now the government has amended the scheme that even people who are caring can be furloughed because of their duties, but then I think it is a balanced view in terms of government having to assess the data to see which are the epicenters of infection, where have we, because we have now gone past that, it has spread in the community, there is no region. So now the question would be that whether we watch out for the influenza like illnesses, ILI, anybody who's got temperature, anybody who's feeling unwell or something, and who have they come into contact, or where are the cases appearing, having that data on a day-to-day basis as the situation evolving, contact tracing, testing those, and then isolating that regions, while the rest of the places which are free of infection, or there is talk of the rapid antibody test, the new data which shows that the plasma of the infected people can actually be utilized as a neutralizing sort of provision for the infected, which gives hope for a vaccine, and which also gives a hope for a treatment in terms of it. And possibly some of the, there is the big discussion goes on about the hydroxychloroquine use, or bleach being used as a disinfectant. So those repurposing of the existing antiviral drugs, if some of them start to work, then we know that we can treat the milder infections that way and keep the really vulnerable people away from exposure. And that contact tracing, identifying, testing, and then isolating, lockdowning those regions or those people or those businesses will be the strategy that we will have to adopt as an exit strategy to start bringing the economy on track. Coming on to the positive side of it, although everything is in lockdown and it has impacted and slowed down, but there are positives to look at it in terms of it, that it has brought people to use technology in ways that people were never looking at it. And most people have realized that they can carry on their lives and they can carry on working and using and working, collaborating with their colleagues, not only in the same community or region or country or organization, but across the world as well, despite not moving out of the house. So I think the workplaces are going to change as a result to some extent. The organizations and the businesses will start to look at flexible working in a very different scenario. It is also an opportunity, even if there is a silver lining ever, for people to start thinking in how can, what is the use of various technologies that they can adapt to make it more efficient. And even in terms of detection, the collaboration of scientific community, clinical community, governments working together to ask. I mean, we are seeing in the news the mighty Trump from America asking for chloroquine from a developing country, India, for hydroxychloroquine dosage. Similar thing is demand, another developing country, Brazil, asking for it. So it's coming. It's a nature cycle which is providing that not if you have economic might, that doesn't give you a health might, or that doesn't make your strategy the best. You still have to learn from other people. You still might be depending on other people. And so I think in terms of having that exit strategy well planned and executed will be a slow process, but we would have to start looking at it once we pass that peak or flatten that curve, as we keep talking about from the beginning, when the infection as a result of social distancing measure is come a bit under control, and we start to find out a bit more where the epicenter of that. So because after that, if it isn't spreading, then if we block the new infection coming into contact and coming into society, then as and when somebody get exposed or somebody starts to show, we contact trace them, isolate them, and then keep the other cogs of the business and the economy slowly start moving, will pick up. And the thing is, because it has been such a complex process and people have been they are naturally worried about it, but also looking at it to come out and do things. So a lot of people will use this time to reflect over, and businesses that are stronger, resilient, and preparing for innovative ways and innovative use of their resources. People are the biggest resources, technology, utilizing that, and then coming up, we will see bounce back of that coming quickly. And the government has obviously provided support in this period for people to survive the worst part of it. So that will give more confidence in terms of coming back and trying to do the best for it.
That makes sense. I mean, it's obviously a hugely complicated situation, and you want to do the best for everyone. It's not easy, but I really appreciate your thoughts on it, and particularly the points of kind of hope about in a few weeks. Hopefully, we'll know much more, and the picture will hopefully be better, and we can start to think about making improvements in the way we live our lives in light of what we've learned going through it. I think you're right. The way we work is going to change forever.
Yeah. And looking at the positive side, which we haven't discussed, I suppose I will just talk about it in terms of the treatment or the vaccination, which we haven't touched. I think vaccine is a process which takes long time. So even if there is hope that the human body can have protecting antibodies, as they have been detected in the plasma, which is found in the blood when you separate the white blood cells and red blood cells from in the human body serum, but that indicates that there is a reaction that the body does mount to the virus, which means that the vaccine will work. But the way that works is that even if with the new data usage and modeling analysis, we identified the right region against which, and there are various groups and already working the research, UKRI, Innovate UK, and NIHR in the United Kingdom, Wellcome Trust, and other NIH and other worldwide bodies are Gates Foundation, and they are putting a lot of money into initiatives to generate and work in collaboration. And that would be a collaboration, a triple helix, both government organization working in partnership with the private sector and public sector research academic institutions. But the process itself is that after it the identified and it does work in the laboratories or research institution, animal testing, it has to go through a phased human testing period of 3 or 4 stages, phase 1, 2, 3, 4, where different things are tested, whether how is the body reacting to it, how is there a side effect, is there toxicity, what happens in healthy people, what happens in people who are given nothing, and is there versus the who are given the dose, and how long does the impact last, and what kind of, so that's a longer period of testing. And even if we were to bypass and expedite everything, I think it is nothing less than 8 months to 12 to 18 months that any vaccine will be here before the next year, we can say, despite fast tracking everything because of the requirements of, because there is regulatory and requirements, say Food and Drug Administration, MHRA, or the organizations that are responsible, they need to make sure. So they could still, something might be available in the hospitals to use on people who are on the last leg and that's their last resort, and they might permit for it. But for a general population to be, because even when it is accepted as a vaccine, to be produced in large enough quantities to be provided worldwide, because this is a world issue, it's not a one particular region or country issue. So that those are the issues that were widely available vaccines. But before that, I think for a general population, small molecules or biologics as they're called, or antiviral, the drugs that are already being used against other treatments, they have been tried or being tried in across various parts of the world in different combinations, different dosage. If some of them start to work, then as it has been shown that they are already in production, there is already a company that is making it, they're being supplied, so they can ramp it up because they don't have to go through that testing or regulatory permission or process. So the hope is that one of those show promising results on symptomatic infected people, and especially the ones that are at high risk symptoms and high risk people. Once it works in them and make them better, then even as we say, we have a combat strategy and we can work against them. And at the moment, there's no data and scientific evidence as such for hydroxychloroquine for which people are using, but it is, I think some people have used it and some have gotten slightly better symptoms. So I think that's how it is being, and it is a normal malaria drug which is being used in parts of the world as an anti-malarial drug. Hence, there is the supply of it is more in India or African countries, because that's where the sort of mosquito bitten malaria is found. So that's the hope for a treatment for now, in terms of that if we find a repurposed drug or a small molecule, because that is much easier to synthesize at that scale once it can be designed. But then even those studies have to be tested in the lab, how human body reacts, who can be tested, who can show side effects, what dose is the right dose, and that's a longer. So the worldwide research and private industry and the sort of funding of bodies, if efforts have joined in and they are working for it. But then I think in overall, I would say that these things will all work only if we have the social distancing and shielding and policy measures, along with something called common sense or social responsibility. And it all boils down to, we can expect so much from the government, we can expect so much from the agencies, but as each eventually as humans and citizens of the world, I think we need to take our own responsibility into something. If we have been told to do something, how diligently are we following it? And if we understand this, we can overcome any challenges. And same is true for health, as our health workers and clinicians in the NHS and nurses and staff have shown that they are putting their lives in risk and working for people. Similarly, from the society side, humans have to do, and in business leaders can motivate and show resilience. It's up to us to say, come up and raise. A lot of businesses will pivot at this time and come up with new models, and that can be a positive sign for how we take forward.
Indeed. Well, I really appreciate you taking the time today, and hopefully we can talk again in a month or so and things look a lot better. Is there anywhere that people can find you online? I know you're on Twitter, and I can link it in the show notes.
I am both on Twitter and LinkedIn. So LinkedIn, Dr. Poonam Malik, and I can be found there. And Twitter, my handle is Poons21. And I sort of, as I'm on the board of Scottish Enterprise, which is the economic development agency, working with that, and Skills Development Scotland, where both are the agencies from the Scottish government side trying to work for the skill improvement as well as business economic regeneration for all the impact that we are seeing. Okay.
Brilliant. Okay, thanks again.
Thank you. Thanks, Ali.